Hello, my name is Dr. Chris Williams and I'm your host on Well Again. Well Again is your online health magazine program in which we look at lifestyle and different other ways of regaining health if one is sick, and also retaining health in order not to be sick. You're welcome. All right, recently we began to be more complementary in approach, especially when we began to discuss fertility. Today I want to discuss overcoming male factor infertility. Overcoming male factor infertility, the complementary approach. Male factor infertility is responsible for about 30% of all infertility cases. Okay, male factor infertility means when a man is unable to produce or provide sperm that is healthy enough to impregnate a fertile woman. When a man is unable to produce or provide a sperm that is healthy enough to naturally impregnate a fertile woman. Okay, so we say there's male factor infertility. Now, the causes of it are numerous. It can start from childhood with undescended testes. When a child is born, one of the first things they did, when a boy is born in the hospital, one of the first things they do is to check whether the testes are inside the scrotum. This is very important in some hospitals or some less than hospital places where people give birth to children. This may be overlooked. So the testes may hang in the abdomen, and as the child grows, that portends to a very dangerous risk. Number one, it can turn cancerous because of the heat inside the abdomen, and it can also give rise to infertility later in life. The temperature in the scrotum is 3 degrees Fahrenheit less than the temperature inside the abdomen, and as such, if the testis remains in the abdomen, doesn't descend into the scrotum, it can lead to infertility. It is called cryptorchidism. All right. Moms also, in Yoruba it is called shegede. The Igbo people call it alankpo. Moms, that swelling you see, especially in childhood, the jaws of the child will swell is caused by a viral infection, and it can lead to infertility also, because one of the other choice places that moms attacks apart from the jaws is the testes. Okay, so somebody can become infertile, a man can become infertile from an attack of orchitis or mom's orchitis in childhood. If a man or a child has also had surgeries, and during surgery the vas deferens was inadvertently damaged, or the seminal vesicle was inadvertently damaged, it can lead to inability to either ejaculate, or it can lead to azoospermia. Okay, and that can lead to infertility. Okay, infections also, especially the ones that are not treated and that went on to become chronic, sexually transmitted infections of any type, gonorrhea, chlamydia, and all that. And this is why it's important to treat infections very well, and it's also why it's also very important to be chaste, to remain chaste, and also to be faithful in sexuality, because people just put their bodies in different places, and then they catch all manners of disease. Okay, infections that is not well handled can lead to damaging of the testes, which can lead to either the blockade of the vas deferens or the seminal vesicle, or the damaging of the testes. It can lead to infertility. Also, chronic illnesses like chronic renal disease, chronic liver disease, thyroid dysfunction, diabetes, long-standing diabetes mellitus, malnutrition, neuropathy from diabetes can destroy, can cause impotence, and it can also be responsible for retrograde ejaculation. What is retrograde ejaculation? When the man releases, that's when he ejaculates, but it does not come out. The thing goes into the bladder and the man has to wee it out as urine. Another thing that can cause male factor infertility are drugs. And by drugs, I mean drugs that we use to treat everyday diseases. For instance, cimetidine and ranitidine are drugs used to treat ulcer. They have been established to cause low sperm count and all that. Also, spironolactone is used to treat hypertension, and it's also been known to also affect the quality of sperms. Isoniazid is used to treat tuberculosis. It can also affect the quality of sperm, and so can colchicine, which is used to treat gout. Okay, some other drugs that are used to treat hypertension, like calcium channel blockers, or drugs like that are used to manage mood stability. This can affect erection, and of course, when there's no erection, there will not be ejaculation, and if there's no ejaculation, we can't even begin to talk about fertility or not. Okay, male bodybuilders and weightlifters and wrestlers, some of them or many of them use anabolic steroids and hormonal agents. These can affect, can cause low quality sperm in a man. Other drugs like alcohol, like tobacco, like marijuana, and all these hard drugs are known to reduce fertility and to reduce potency. Okay, exposure to heat also. Excessive exposure to heat, especially in the exposure of the groin area to heat, okay, can also destroy spermatogenesis. Spermatogenesis is the process by which sperm is made in the body, and it's a process that does better under cooler environments. That's why God intelligently hung the testes in the scrotum outside of the body. The temperature in the scrotum is 3 degrees Fahrenheit less than the temperature inside the body. So anything that increases the temperature around the scrotum is already affecting a man's fertility. Okay, and there are different things. A man is a commuter driver, or he works in a place where that place is excessively exposed to heat, or in our generation, people carry laptops in their laps and all that. All those can destroy, and they are established to destroy the quality of the sperm. Other things like if somebody is having fever, or abuse of saunas and hot bathtubs, all these increase the temperature around the scrotum and then destroy the quality of sperms. When I come back, because I'll go on a short break now, we'll continue. Please do not go away. I'll be right back. Okay, you're welcome back. We are looking at the causes of male factor infertility. What causes the quality of sperm to be low, the volume of sperm to be low, or for there not to be sperm there at all, or for the man not to even be able to ejaculate. Those are the things that we are looking at. So workplace hazards, okay, if somebody works in a place where they use a lot of heat, so his body is always hot, it's not good at all. It can destroy his sperm. Environmental toxins, insecticides, herbicides, and exposure to heavy metals like lead, like cadmium, like mercury and arsenic. Also, abusive diets, diets that are not good, and we have spoken about diets severally for several years. We're talking about it. Sweet things, abuse of animal proteins, use of gluten, or use of flour and wheat which contains gluten. These destroy the body. Eating of fried things, they destroy the body, just like they also destroy the scrotum and the testes and the man's fertility. Okay, also things like wearing tight pants or leather pants or nylon pants. People wear all kinds of things, you know. This in this generation, the tighter the better. All those things do not allow. There's a reason God created this scrotum and left it sagging, left it dropping like that, just like dropping the way it's dropping. It's not supposed to be just opposed to the body, because it will be heated up, and that's not good. So if somebody is wearing tight things always, they are on their way to making themselves infertile one way or the other. Now, what should you do? The first thing to do is, when a couple have been married for 6 months, 8 months, 9 months, 1 year, and pregnancy has not been achieved, say out, go see a doctor. It's so very important. Call in, let's tell you what to do. Okay, go see a doctor. That's very important. Some people wait 5 years, 6 years, 7 years. Some people even 10 years. They have never seen a doctor. In their mind, they are believing God and they are waiting on God. Listen to me. God has made provision for your fruitfulness. You have to take it by force. The violent take it by force. And God has blessed people with knowledge of science to help you overcome what you are going through. What people don't know is that the longer the inability to conceive is, the less the chances of overcoming it. If two patients present, one 7 years and another one they've been waiting only for 1 year, the people who have been waiting for 1 year have a better chance, and that is the truth. Okay, number 2, marry early. Very important. Okay, so marry early. Don't wait till you are 40, you are 45 till before you are marrying, because the fertility of men drop from around 40. Okay, so when you see a doctor, they will do extensive examinations for you. They will check the size of your testes, they will check the texture, they will check the positioning, they will check if there are varicocele. Varicocele are distorted, dilated, tortuous veins on the body of the scrotum. If this is there, it can increase the exposure to infertility by 15 to 40%. Okay, so the clinician will do some tests for you. Usually, most clinicians will first do a seminal fluid analysis. They will make the man produce sperm, and then they will check it in the lab. Some people are averse to that. Some people think that that's a terrible thing. Why should I be producing sperm and all those kinds of things? And I tell them, you can do it in a way that appeals to your conscience. Okay, even if you don't want to do it by masturbation, you can do it by meeting with your wife, and just at the point of ejaculation, you pull out, and then you put it in the bottle that is provided. Just ensure that it gets to the lab 30 to 60 minutes after you have produced it. All right, so usually in healthy sperm should be 2 to 5 mils in volume. It should liquefy in 30 to 60 minutes. It should contain at least 15 million sperm cells, and the normal ones, sperm cells have head and tail. The normal ones should be at least between 4 to 40%, and at least 50% of them should be active. That's the motile proportion should be 50%. And then it should be less than 1 million WBCs. That's very, very key. Less than 1 million WBCs. If it is more, then the cervical mucus can begin to react to it. It's important to know that the seminal fluid analysis should be done at least 3 times before we come to a conclusion. The doctor will also check your FSH, do some hormonal tests for your LH, testosterone, prolactin, and see to rule out certain things. Well, there are many things that can derange a man's hormones. You see, production of sperm does not start and end in the uterus, in the testes. It starts actually from the brain, from the pituitary gland, and from the hypothalamus. Okay, in conditions like Kallman's disease or Klinefelter syndrome, Sertoli cell syndrome, all these things have issues up there, and in Kallman's syndrome, there will be low FSH, and then in Klinefelter syndrome, there will be let me put it this way. Klinefelter syndrome indicates testicular failure, okay, and then the Sertoli cells only syndrome also indicate testicular failure. Okay, other tests that can be done are karyotyping, genetic testing, and all kinds of things. If you see your doctor, they will tell you exactly what to do. Okay, so what should you do at home? Right from childhood, I'm talking to parents now. Make sure that at the hospital, after your boy is born, make sure that they check for presence or absence of undescended testes, or presence of or absence of testes in the scrotum. Very important. And if there is undescended testes, it's important they do something about it. Also, teach the child to protect their groin while at play and while growing up. Tell them the importance of protecting that aspect of their body. Very, very important. Very, very important. Also, if a child has mumps while growing up, make sure you treat it very adequately, because mumps can also that attacks the cheeks can also attack the testes and destroy the boy's fertility. Okay, only that you just get to know in future. Okay, for the man, start your family early. It's important. Fertility begins to dwindle from around about 40 in men, and if you are married, you've not been able to impregnate your wife in 6 to 12 months, seek help early. And when you seek help, cooperate with whatever they're asking you to do. If they ask you to do a test, do it. Very important. Let them examine you thoroughly. Okay, it's so very important. You need to produce sperm so that we can exactly know what's up with your sperm. Also, eat right. Remove sweet things, fried things, flours and wheats which contain gluten, and abuse of animal proteins. Remove them from your food. Remove junk food from your food generally. Be more plant-based. Very important. Be more plant-based. So at the hospital, they can do some more things for you, and if you do not know any place where you can go, or if you want to be directed on where you can go, you can contact us. Okay, I told you, myself and some of my friends were working on starting an IVF, a fertility cum IVF center very soon, and I promises to really deliver some of the best that we have around here. Okay, many things that can be done for you in the hospital. They can do IUI for you. They will take your sperm, they will sieve it, and then concentrate it and put it inside your wife. If the sperm count and quality is really very terrible, then you need ICSI. You need ICSI, intracytoplasmic sperm injection. They will take a single sperm of yours and then put it right inside the egg, and it will become an embryo, and then they will plant it back into your wife's body. Okay, IVF can also be useful if the sperm is not too bad. Okay, it can be useful. Avoid stressful life. Stress kills fertility, both in men and in women. Surgery, you may need surgery, and surgery may come in very handy. Surgery like varicocectomy, okay, and then some other little surgeries that they can use to unblock either a blocked vas deferens or a blocked seminal vesicle. Okay, very, very important. If you can't produce sperm, no alarm. They can literally put an injection, it's a bit painful, into your testes, and then aspirate the sperm, and then treat it, and then put it into your wife via IUI or IVF. What are the natural substances that help with low sperm count? Or have even gotten results with azoospermia. Sometimes azoospermia is no sperm at all. We have seen it come up with some of these natural things. Supplements, first of all, vitamin B complex, vitamin C, folic acid, zinc, vitamin E, selenium, very important, L-arginine, L-cysteine, L-methionine. These are very powerful. Ubiquin, these are very, very powerful in helping to shore up your sperm. Also, some herbs that are useful are herbs like astragalus, grape seed extract, and there's a preparation called raw orchic glandula, and we have used it to help a whole lot of persons. Some other ones like yin yang huo is a Chinese herb, is very useful. That's actually what is called honey goat weed. Honey goat weed is very useful in helping to build sperm. Okay, maca and damiana are very useful in helping your potency. And some other things that help potency are things like Jamaican sarsaparilla and saw palmetto. I forgot to say that there are some other medical things that can, for some persons, is just some tablets and some maybe accompanied with these herbs and supplements that they will need, or some injections here and there. If the FSH is low, we can give FSH and HCG injections, and then to the person's sperm over like 3 months, 4-5 months will wake up. Okay, and then clomiphene also, so we know that they use clomiphene in women. It can also be used in men to boost sperm production. All right, this is as far as I can go. If you need to know more, you need to call us. Do not forget, we have not given prescriptions, we have just given these by way of information. Don't forget to subscribe to this channel. Don't forget to turn on your notifications so you can get to know when new videos are loaded, and then send this URL to somebody who needs it. If you're a parent watching, your children are grappling with it, or your sibling, or your relatives, your cousins, your nieces are grappling with it, don't forget to send it. So very, very important. We have some books here, Reversing Depression Naturally. Okay, these books can be sent to you in any part of Nigeria. Sickness Free, it can be sent to you. Reversing Diabetes Naturally, and then Make Your Food Your Medicine. Make Your Food Your Medicine. And then, of course, Living a Disease-Free Life can be sent to you. Do not forget, if you start early, your chances at being able to eventually be pregnant and produce are higher. God bless you. Bye-bye.